All right, getting ready for a health psychologist interview. Well, good for you. We've got all sorts of great resources from RoleCatcher to help you totally nail it.
It's a fantastic field to be going into, so important now. Using psychology to improve people's lives, helping folks stay healthy and prevent illness.
Yeah, like it's really making a difference. And that's what we're diving into today, going deep with some sample interview questions from RoleCatcher.
We're going to break down each one, think about what the interviewer is trying to get at, and of course, how to answer in a way that really makes you shine.
Okay. Imagine you're in the interview and they ask you about your experience working with patients who have chronic illnesses. That could be a tough one, right?
Yeah, you really got to think about what they're looking for there. It's not just listing off the conditions you've dealt with. They want to see how you approach those unique challenges, how you think about the long-term care involved with chronic illness.
Right. It's about your perspective, how you see things.
Exactly. So you got to have some good examples ready, specific cases where you've helped patients manage their conditions. Like, did you ever use motivational interviewing to help a patient with diabetes take charge of their health? Or maybe facilitated a support group for folks dealing with chronic pain?
Yeah, bring those experiences to life. Like, don't just say you did it.
Right. Tell them how you did it, what strategies you used, the challenges you faced, how you measured the impact of your work.
And probably have some follow-up questions too, right?
So definitely, they might ask about the toughest part of working with a specific patient or how you collaborated with other healthcare professionals to provide, that well-rounded care.
So you got to be prepared to go deeper.
Yeah.
Okay, what if they ask you about how you stay up to date with all the new developments in health psychology?
They want to see that you're committed to lifelong learning. It's a field that's always evolving. So mention specific journals you read, like maybe the Journal of Health Psychology, conferences you attend, online courses you've taken.
And RoleCatcher actually lists a bunch of great resources for professional development in their career guide.
Yeah, it's super helpful. And be ready for that follow-up question, too. They might ask about a recent breakthrough in health psychology that you're excited about. This is where you can really let your passion shine through.
Love it. Okay, next question. How do you adapt your approach to patient care, based on cultural or linguistic differences? I mean, the world is just getting more and more diverse.
This is so important. Health psychology is all about understanding each individual in their context, and culture plays a huge role. RoleCatcher really emphasizes providing culturally sensitive care, especially in a diverse environment.
So how do you show them you get it?
Think of specific situations where you had to be mindful of cultural differences. Did you ever adjust your communication style for a patient from a culture that values indirectness? Or worked with an interpreter to make sure everyone understands each other?
Right. Highlight your ability to adapt and provide effective care no matter the culture.
Yep.
Yeah.
Be ready for those follow-ups too. Like, what resources do you use to enhance your cultural competency? Or how do you address any potential biases in your own practice?
They really want to see that commitment to continuous learning and self-awareness. Okay, now let's get a little technical. What about experience with program evaluation and outcome measurement?
Yeah, don't let the jargon scare you off. It just means understanding research methods and how to measure how effective those programs are.
So how can you make this relatable for the interviewer?
Think of a concrete example. Let's say you designed a stress reduction program for college students. How would you know if it was working? You could use surveys, right?
Right.
Before and after the program to see if there's a change in anxiety levels, sleep quality, or how stressed they feel.
Right, the proof is in the pudding.
Exactly. And be prepared for follow-up questions about your statistical skills or how you handle those ethical considerations when collecting data.
Okay, let's talk about working with patients who might be resistant to psychological interventions, those who aren't exactly excited to be in therapy.
We've all had them. It's a real test of your people skills, how you build rapport and empathy. You've got to meet the patient where they're at, understand their resistance, and find a way to get them engaged in the process.
How can you really shine in answering this one?
Share a story. Tell them about a time you faced resistance, maybe a patient who was skeptical about therapy. Explain how you approached them, how you earned their trust, what strategies you used to get them involved.
And what kind of follow-up questions might they ask?
They might ask about balancing patient autonomy with encouraging them to try new approaches. It's a tricky balance, and they want to see that you can navigate it with sensitivity and respect.
Really important. Okay, another common question is about your experience with health behavior change interventions.
It's all about helping people develop healthier habits, which is a big part of health psychology. This question is your chance to show off what you know about those evidence-based interventions and tailoring them to individual needs.
Okay, so what are some examples of interventions you might mention?
Think motivational interviewing, cognitive behavioral therapy, mindfulness techniques, anything like that. Give concrete examples of how you've used these approaches and the results you achieved.
And be ready to discuss how you choose the right intervention for each patient and those common roadblocks to behavior change.
Exactly. It's all about demonstrating your clinical judgment and how you adapt to each patient's unique situation.
Okay, now this next question is interesting. How do you feel about patient advocacy and empowerment? It's like going beyond just individual care, right?
Absolutely. It's about understanding that patients often need help navigating the healthcare system and standing up for themselves. This question is all about showing your commitment to empowering patients, helping them take an active role in their own health and well-being.
So how can you showcase your advocacy skills?
Talk about times when you went the extra mile for your patients. Did you help them access resources, connect them with support groups, educate them about their rights? Those are all examples of championing patient well-being.
What about those follow-up questions?
They might ask about balancing advocacy with maintaining those professional boundaries. It's important, that ethical consideration. They want to see that you understand the nuances of the patient-provider relationship.
Okay, before we go any further, can we talk about those awesome AI features that RoleCatcher has?
Oh, yeah, they're a game changer. It's not just about information, it's about personalization, giving you a real edge over other candidates.
Exactly. Think about this. RoleCatcher's AI actually analyzes the job posting, picks out the keywords, the skills they're looking for, and then it suggests ways to tweak your CV and cover letter so they match up perfectly. It's like having your own personal career coach.
And it gets even better. They also have AI-powered feedback on your interview practice. You can record yourself answering these very questions we're talking about and get personalized insights to help you improve how you deliver those answers, your content, even your body language.
That's amazing. So you're walking into that interview prepared, confident, and polished. Okay, I'm ready for the next batch of questions. What do we have?
Okay, let's tackle question number 8. Can you describe your experience with interdisciplinary collaboration?
That's a big one, right?
Yeah.
Because health psychology, it's not a solo mission.
Nope, not at all. You're going to be working with all sorts of folks, doctors, nurses, social workers, the whole healthcare team. They want to see that you can play nice with others, communicate well, share information, and work towards that common goal.
So how do you make this come alive for the interviewer?
Think about concrete examples. Have you ever been in a case conference where you shared your psychological assessments and made recommendations? Or helped develop a treatment plan with other professionals? Or maybe you had to navigate a disagreement with a colleague about a patient's care.
Those are great examples. And I'm thinking, RoleCatcher's AI tools, could they help with this kind of question?
Absolutely. Remember, the AI can analyze the job description and highlight those key skills and experiences they're really looking for. So if teamwork and collaboration are front and center, the AI will help you tailor your answers to really nail those points.
Smart. So question number 9. Can you describe your experience with grant writing and research funding?
Now, this one might not apply to every health psychologist role, but it's definitely a valuable skill, especially if you're thinking about research or academia.
What if you don't have a ton of grant writing experience?
No worries. Even if you haven't led a grant proposal, you can still talk about the funding process, how you develop research ideas, or any time you've collaborated on grant-funded projects. The main thing is to show them you're interested in research and you get how it's funded.
But if you do have experience, this is your time to shine.
Right. Tell them about grants you've secured, the amount of funding, the impact of those projects.
I bet RoleCatcher's AI can even help quantify that impact.
Exactly. The AI can turn those achievements into hard numbers that the interviewer will really understand.
I'm telling you, RoleCatcher's like having a secret weapon for interview prep. All right, question number 10. Can you describe your experience with clinical supervision and mentoring?
This one's all about showing off those leadership skills, your ability to guide and support others in their professional development.
So it's not just about being a good clinician, but about helping others become better clinicians.
Exactly. Whether you formally supervised interns or mentored colleagues, they want to know if you have the skills and the desire to help others grow in the field.
What are some good examples to share?
Think about times you've given guidance, feedback, or support. Maybe you helped a colleague with a new intervention strategy or provided some constructive criticism on a case presentation. Share those stories that show you can teach, mentor, and inspire others.
What about those follow-up questions?
They might ask about the challenges of supervision, how you handle those, or how you create a positive and constructive learning environment for your mentees. It's about showing you understand the dynamics of mentorship.
This whole interview prep thing, it can feel a bit overwhelming.
Yeah, I get it. It's normal to feel some pressure, especially when it's a career you really care about. But you can do this.
It's more than just a pep talk, though, right?
Mm.
There are things you can actually do to feel more confident and less anxious.
For sure. And that's where RoleCatcher's AI can really make a difference.
You're talking about that interview practice feature.
That's the one. Imagine this. You record yourself answering these questions, and the AI analyzes your responses. It gives you feedback on how clear you are, how concise, your use of examples, even your body language.
Wow, it's like having a personal interview coach.
Totally. You go into the interview prepared, polished, and confident, knowing you've tackled any potential weaknesses.
Knowing that you've put in the work makes a huge difference. Okay, ready for more questions?
Hit me with them.
All right, question 11. What are some of the ethical considerations that are important in health psychology? I mean, ethics are a big deal in any healthcare field, but it seems especially crucial in psychology, right?
You got it. Health psychologists are dealing with really sensitive information, personal struggles, complicated relationships. Maintaining those ethical standards is crucial to protect patients and the whole profession.
So what are some of the key ethical principles to be ready to discuss?
Think about confidentiality, informed consent, boundaries, those kinds of things. Be prepared to explain how you would handle situations where these principles come into play. Like, what would you do if a patient told you something that could put them or someone else in danger? Or how would you make sure you're not creating a conflict of interest with a patient? Those are the kinds of scenarios they might throw at you.
And here's another role catcher tip. Their AI can actually look at your past experiences and suggest specific examples that showcase your ethical decision-making skills.
Exactly. The AI helps you connect the dots between what you've done and the ethical considerations of the job.
Okay, moving on to question 12. How do you approach working with patients from diverse socioeconomic backgrounds? This seems really important given the inequalities in healthcare access.
Absolutely. Health psychologists need to understand the challenges faced by people from different socioeconomic backgrounds. Those factors can influence their health behaviors, their access to care, even their trust in the healthcare system.
So how do you show them you're aware of these issues and committed to providing fair and equal care?
Think about your experiences working with diverse populations. Have you volunteered at a free clinic, provided services to underserved communities, or had to advocate for a patient facing financial barriers to care? Share those experiences and how you adapted your approach to meet their unique needs.
And be ready to talk about any biases you see in the healthcare system and how you would work to fix them.
Yes. This question is all about showing your commitment to social justice and health equity.
Now, question 13 brings us to the digital age. How do you integrate technology into your health psychology practice? That's a hot topic these days.
It really is. Technology is changing healthcare so fast, and health psychology is right there in the mix. The interviewer wants to know if you're keeping up with those changes and how you might use tech to improve patient care.
So what kind of tech should you be ready to talk about?
Think telehealth platforms, those mobile health apps, wearable fitness trackers, online support groups, even virtual reality therapy. Share examples of how you've used these tools or how you see yourself using them in the future.
And of course, there are those ethical considerations, right?
Definitely. They might ask about patient data privacy, potential issues with the digital divide, or the challenges of delivering care through a screen. It's important to show them you're thinking critically about how technology impacts healthcare, not just blindly embracing it.
Great points. Okay, on to question 14. Can you describe your experience working with community organizations or public health agencies? This seems to go beyond just individual care.
It does. Health psychologists often work outside the therapy room, collaborating with community partners to address health issues on a larger scale.
So how do you show them you can work within a system to improve community well-being?
Think about any partnerships you've been part of. Have you worked with schools on health education programs, teamed up with local businesses to promote workplace wellness, or worked with community leaders to advocate for public health policies? These are all great examples of how health psychologists can make a difference beyond one-on-one therapy.
And I'm sensing another RoleCatcher AI opportunity here.
You know it. The AI can analyze the job description, pick out keywords related to community engagement or public health, and then suggest examples from your past that fit those keywords.
Okay, it's official. RoleCatcher's AI is like a personal cheat sheet for acing interviews. Let's move on to question 15. Can you describe a time when you had to deal with a difficult or challenging patient?
Ah, the classic difficult patient question. It's a staple for a reason. Every healthcare professional will face this, and they want to see how you handle those tricky situations.
So what's the best way to answer this one?
Remember, they're not expecting perfection. They know difficult patients are part of the job. What they want to see is self-awareness, empathy, problem-solving skills, and how you stay professional under pressure.
How do you pick the right example?
Choose a situation that shows your ability to stay calm, de-escalate conflict, and find solutions. Maybe you had a patient who refused treatment or was always angry and disruptive. Walk them through how you assessed the situation, the strategies you used, and what you learned.
And be ready to talk about the ethical considerations involved.
Right. Things like confidentiality, informed consent, and your duty to warn.
Okay, we've made it through a lot of questions today. But before we wrap up this section, I want to loop back to RoleCatcher's AI features. We've talked about how it can help personalize your CV, your cover letter, and even provide feedback on your interview practice.
Yeah, those are super helpful tools. But there's one more I want to highlight, RoleCatcher's salary negotiation tool.
Oh yeah, tell me about that.
So picture this. You nailed the interview, and now it's time to talk salary. RoleCatcher's AI analyzes salary data for similar positions in your area and gives you a personalized salary range based on your experience and qualifications.
That takes all the guesswork out of it and gives you the confidence to ask for what you deserve.
Exactly. It can even suggest negotiation strategies based on the company's industry, size, and reputation.
Wow, they've thought of everything. Okay, I'm ready for those last 5 questions. Let's do it.
Okay, let's jump right into question 16. Can you tell us about a time when you had to work with a patient who is non-compliant with their treatment plan? This is a really common scenario in health psychology, and it can be tricky to navigate.
Yeah, for sure. You want to support your patient's autonomy, but also guide them towards what's best for their health. It's a tough balance.
Exactly. And the interviewer wants to see that you can handle those situations with grace and empathy, that you have a solutions-oriented mindset. They're not looking for someone who gets flustered or judgmental when a patient doesn't follow their recommendations.
So how can our listeners answer this one effectively?
Think about a specific time when you faced this challenge. Did you have a patient who was resistant to taking their medication, or maybe someone who kept skipping therapy sessions? Walk the interviewer through how you approached the situation. Did you try to understand the reasons behind their noncompliance? Did you involve them in adjusting the treatment plan to better fit their needs and preferences?
And it's important to show your problem-solving skills too, right?
Absolutely. Talk about the strategies you used to address the noncompliance. Did you use motivational interviewing techniques to explore their ambivalence? Did you collaborate with other healthcare providers to come up with a more holistic approach? The key is to show that you're proactive and committed to finding solutions that work for both the patient and the treatment goals.
And I bet RoleCatcher's AI could help identify which strategies to highlight based on the specific job description.
Spot on. The AI can analyze the employer's priorities and suggest which of your experiences and skills to emphasize in your response.
All right, let's move on to question 17. What are your strengths and weaknesses as a health psychologist? This is such a classic interview question, but it always makes me a little nervous.
I get it. It can feel like you're walking a tightrope. But remember, this question is a chance to show your self-awareness and that you're committed to growth.
So how do you answer this one without sounding too rehearsed or, trying to disguise a strength as a weakness?
When talking about strengths, focus on qualities that are genuinely your strong suits and relevant to the job. Are you a good communicator? Do you build rapport easily with patients? Are you passionate about keeping up with research? Back those claims up with specific examples from your work experience.
And what about weaknesses? Any tips for handling those gracefully?
Choose something you're actually working on improving, nothing superficial or irrelevant. For example, maybe you're a bit shy about public speaking, but you've been practicing to get better. Or maybe you tend to get stuck on details and you're learning to delegate more effectively. It's all about showing you're self-aware and proactive about addressing your areas for growth.
I love that. You can turn a potentially tough question into a way to show you're dedicated to professional development. Okay, question 18. Where do you see yourself in 5 years?
This one's looking ahead, trying to figure out your ambition, your career goals, and how this role fits into your long-term plan.
So how do you create a compelling picture of your future aspirations?
Think about what you really want to achieve in the next 5 years. Do you want to specialize in a particular area of health psychology, like oncology or pediatrics? Do you see yourself pursuing research or maybe teaching? Do you have any leadership aspirations? Be specific about your goals and how this position aligns with your overall career path.
And don't be afraid to be ambitious. Employers want to see that you're driven and motivated to succeed.
Right. And be ready to talk about the steps you're taking to reach your goals. Are you getting additional certifications or training? Are you actively networking with people in your field? Show them that you're not just dreaming, you're actually working towards making your vision a reality.
Okay, we're almost there. Question 19. Do you have any questions for us? This is your chance to flip the script and get some information that's important to you.
It's such a crucial part of the interview, and so many people miss this opportunity. Having good questions shows that you're engaged, curious, and truly interested in the position and the organization.
So what kind of questions should you ask?
Think beyond the basics like salary and benefits. Ask questions that give you insight into the organization's culture, values, and priorities. For example, you could ask about professional development opportunities, how the team collaborates, or the organization's commitment to diversity and inclusion.
You can even tie your questions back to something that came up earlier in the interview. Like, if they mentioned a new initiative related to technology and health psychology, you could ask for more details about how you might be involved.
Great strategy. It shows you're paying attention and thinking about how you can contribute.
And last but not least, question 20. Is there anything else you'd like us to know? This is your closing statement, your final chance to make a lasting impression.
It's your opportunity to reinforce your enthusiasm for the role, highlight a key strength or experience that you haven't mentioned yet, or simply express your gratitude for the interview opportunity.
So what's your takeaway message? What do you want them to remember about you when they're making their decision?
Keep it brief, genuine, and memorable. This is your chance to leave them with a positive and lasting impression.
Well, we've covered 20 interview questions, explored potential follow-ups, and even learned about those amazing tools from RoleCatcher. I feel like I could walk into a health psychologist interview tomorrow and totally nail it.
Me too. But remember, preparation and practice are key. Take the time to think through those questions, crack your responses, and use RoleCatcher's AI to really fine-tune your approach.
And most importantly, believe in yourself. You've got the knowledge, the skills, and the passion to succeed. Go out there and make it happen.
And that's a wrap on another deep dive. We'll be back soon with more resources and insights to help you on your career journey. Until then, keep learning, keep growing, and keep diving deep.